Welcome to The Confident Patient in a New World. I'm your co-host, Beth Myers, founder of To Right to Health and co-author of The Confident Patient. With me today is my co-author of The Confident Patient. While The Confident Patient book outlines interviews and conversations with medical staff, we quickly realized that these conversations must continue past its pages. So we're talking with medical professionals about all sorts of challenges patients and their caregivers are facing now, given so many changes in healthcare. Joining us today is Terri O'Brien. Terri is an advanced practice provider, nurse practitioner at Rush University Cancer Center and leader of the Cancer Center Urgent Care. Let's start with some of your recent experiences as a nurse practitioner, and I'll let Wendy take it from there.
Thanks, Beth and Terri. We're so excited to have you join us today.
Well, thank you for having me.
Absolutely. So, we've worked together in the past, and we know how important communication is across the lines in healthcare, but particularly when someone's dealing with a cancer diagnosis. So can you share a little bit with us about the importance of communication when people are dealing with such a tough situation?
Communication is key. It's essential between your care providers, between your family. Probably it's hard right now because of COVID and limited visitation and not having a support person with you at all times. So that's one of the first questions I ask. Is there someone you'd like me to call to include in this conversation?
That's great. Yeah, no, thank you for doing that. So many, when we wrote the book, if you were to say what's your soapbox and what do we try to beat into people is take someone with you to your doctor's appointment. And sometimes people are allowed to do that right now and other times they're not. Sometimes the people at the front desk say nobody can come and then we don't send someone and then the doctor will say, well, where's the person with you at the appointment? You can have someone with you. So I think we really need to clarify with the medical providers on if they're allowing visitors or not.
Oh, absolutely. I mean, we're fortunate in our center, we pre-screen every patient. Okay. And if there is a need, whether it be due to memory issues or just anxiety, we are now allowing one support person to come. But you need to ask that question. Can I bring someone with me?
Last week, I went to an appointment with someone with dementia, and the medical assistant took him and said, well, nobody can go back with him. And I was like, well, good luck. He has dementia. You won't figure anything out. No, eventually, she came back a couple minutes later and said, well, you can come back now. And I was like, yeah, of course.
Yes, absolutely. I think that's been one of our biggest challenges. And not only that, but for families to understand why we're doing it. I mean, we don't have enough seating capacity to socially distance, plus trying to protect our compromised patients.
Right. No, it's for good reason, of course.
Yeah.
So I think that, Terri, your recommendations of, asking the question and sometimes having the additional person there sounds like it can definitely be accommodated, but even if it can't, then knowing that the option is that there's also the opportunity to include someone on the phone, just knowing that those are areas where we can still be there with our loved ones, even if it's a little bit more challenging right now.
Yeah, I mean, patients have brought up FaceTime on their phones. We've done it that way. Just talking, on speakerphone, but definitely, especially with oncology, you have to incorporate the whole family, all the caregivers.
Absolutely. And when you talk about the whole family, when the family or the support system wants to help and understand really the role of the medical team, how do you explain that to patients that are maybe somewhat new in this journey of, dealing with cancer? How can their family really understand the role of the medical team?
The team is complex and collaborative. Not only is it your physician, but it may be a nurse practitioner or PA, but also we incorporate psychosocial oncology, we incorporate dietary, a lot of different players. So it's not just your physician. They may be your key person, but also incorporating the whole team.
Which is so important. Years ago, that just did not happen. I love to see all the different disciplines being able to chime in and help from all different aspects of care.
Well, it provides more comprehensive care for the patient.
Mm-hmm.
And then you also get different explanations of your disease process, as well as what your treatment regimen will be and how we can support you through that.
Yeah. Great.
And people can explain the same complex information in very different ways, right? So there might be an opportunity to hear the information from the way that a different medical provider is explaining it that really can resonate with us and help us understand it. One of the things that we say in the Confident Patient is really trying to make sure that we understand, even in terms of being able to explain it to someone who's 10 or 12 years old, right? Like if we can't understand it ourselves enough to be able to explain it to a niece or nephew, maybe we need to be using different words to make sure that we're all on the same page and can truly understand what's going on with us.
No, you're absolutely right. Absolutely right.
So when we think about, a family or a support system, if they're really trying to be there to help support the patient, what can they do that's helpful for the medical team so that everyone's kind of working in conjunction together?
I can think of a couple circumstances. Many of our patients are very stoic and they're not quite forthright with their symptoms or, just generally how they're feeling. And it is always helpful to have a family member there to clarify. I mean, we can pick up when someone's not telling us the whole story. So we tend to look to the family then and get their input also.
Yeah, so important.
So with, all the changing restrictions, with the things tightening up in terms of who can attend the appointments, and then maybe the restrictions being a little bit pulled back when the numbers are getting better. What are things that you've been able to adjust with your clinics and the situations with the patients? Like, have you been able to use telemedicine, or with the cancer population, is it primarily been in person?
It was probably during the peak of COVID, telemedicine was probably 80%, but we are back down to about 15-20%. They have put a lot of safety and thought into how patients can move through the clinic. Patients are absolutely protected. Patients need to not be afraid to come. That's been one of our problems, is people don't want to come in because they're still afraid of exposure. Not only do we have social distancing, but if we suspect that a patient has any symptom of the coronavirus, they are handled in a completely different manner. They don't come through the front desk. They call a private number, are escorted upstairs and isolated right away. So yeah, and it's specifically with urgent care. Obviously, we could not do telemedicine because people are sick. And we need to be able to really lay hands on and do a good assessment.
Speaking of that urgent care at Rush, when did they start that program? I mean, it was so helpful for our patients. So instead of, for those that don't understand what that is if you have cancer and you just need some IV fluids or something, you don't need to go to the emergency room where you're around many other patients with totally different diagnoses. I mean, you go to the urgent care center at Rush, which has really been much quicker, safer. Your team is there. Like, it really has made a great difference. How long has it been there for?
We have been open for 3.5 years, which just kind of amazes me because the time has flown by. It has grown immensely, and we've been able to make our processes better. And expanded hours. We're now available on Saturdays also.
Great to know.
And so what are some of the main reasons that someone would utilize this service, Terri?
I think the biggest reason, one, yes, it does keep people out of the ER, but you're coming to experienced oncology providers that know oncology. You're not going to the ER and they'll start running all these tests that are not necessary, when we can look at you and say, oh, that's because of this, or, this chemo agent did that, or, oh, you're neutropenic, we'll start antibiotics. I mean, I think the biggest thing is you're being taken care of by someone who knows oncology.
And that's got to be so, not only is it make sense from a medical perspective, but it's got to make such a difference from an anxiety perspective for the actual patients and their families, knowing that people have specialized in this field and feel so reassured.
And they also have seen us walking around, so it's a familiar face rather than walking into a strange environment and meeting somebody new.
Right.
When I've had some family members that unfortunately have had cancer, and it's always interesting, the nurses that take care of them, because they will know almost to the hour where they're going to start getting sick after a certain medication. They're going to say, you know, okay, it's Tuesday at 4 on, you know, Friday at 6, you're going to feel like, you know, a bus hit you. And you're going to be like that for 2 days, but then, you know, you're going to feel better. So I definitely think that kind of information is very helpful. And so when they come to your urgent care, I mean, if they went to the regular ER, someone might just be like, oh gosh, you know, and go down a different path, where if it was in cancer, they'd be like, oh, this is exactly what we thought was going to happen at this time.
Especially in the past year and a half, we have so many new targeted therapies that inhibit a certain part of the cancer cell from functioning, but it can cause immune responses in your body. And if you're not, like, say, forthright with an ER physician and tell them, you know, well, I'm on such and such, they won't think right away to go to any of these immune responses that can occur. And you end up with all kinds of testing.
Yeah. Yeah.
So,
frustrating.
Yeah, that's changed a lot in the last year and a half.
That's great.
I would think that people who are dealing with a new scary diagnosis are already going through a lot of anxiety. Like, we all know that. We all have had close contact with people that are going through that. Have you found that COVID-19 has increased that anxiety? And if so, how do you deal with that when you're, you know, establishing a relationship with your patients?
I think that's one of the biggest challenges, is to make the patient feel comfortable. They're scared when they get there. They don't feel well. I think fortunately we have incredible staff that, you know, you find a common ground first and just listen. If you just listen to them and let them tell you their story, you kind of set up that rapport right away. We're very fortunate. We have a strong psychosocial oncology department, and we now have a team that we can call if someone is just out of control with anxiety. Yeah, that's new since it started in the middle of COVID-19, and it's been very helpful, very helpful.
It sounds like it would be beneficial whether we're going through a global pandemic or not.
Right.
Just
have to be an oncology patient to have that. I'm guessing yes.
Yeah.
Well, Terri, thank you so much for your time today. Are there any additional thoughts that you'd like to share with us?
The only thing I want to share, and it's something that I encourage, and the way a patient can advocate for themselves. Just listen and learn. And there is no stupid question. If you don't understand what your physician or your NP or any other team member is telling you, just stop them and have them clarify. That's my biggest thing. If our patients are educated, it is so much better for them as well as it's better for us.
That's great information. Thank you so much. Thank you, Terri O'Brien, nurse practitioner at Rush University Cancer Center. If you would like to connect with Terri, you can email her at Teresa O'Brien, that's TERESA_OBRIEN at rush.edu. In the meantime, be sure to check back with us as Wendy and I continue our conversation with medical experts as we help the confident patient in the new world.
And from all of us at 2x2 Health, we wish you great confidence and health. Thank you, Terri. Bye-bye.
You're welcome. Thanks.